In today's episode, we are diving into the tension between expectation and reality, something every health professional knows too well. It's about those moments where your clinical plan, your training, and your emotional bandwidth are challenged, not by procedures, but by people. And it's a dilemma. And to discuss this today, we have Dr. Jimmi Patel here. Welcome back to the show, Jimmy.
Hi, Kritika. Thank you for having me again.
Today, I want to set a scene for you in our
Right.
in our own practice, and you were there on that day at the clinic, so I'm sure I'll take you back in the memory lane. So in the morning, at about 9 o'clock, this 8-year-old patient was booked in, and the appointment book said her name, 8-year-old patient, first dental visit. She was booked in with one of my associates, and for a toothache appointment. So as you know, just for the audience, that our appointment books are color coded.
Oh, yes.
Yeah.
Yep.
And every single treatment has a color. Like a toothache patient would have a purple, filling would have a blue, Invisalign green, etc. And most, like at your and my age and experience, I think, or any experience more than that, a clinician would have a look at their day. They would get a ballpark idea of how their day was going to
It's
flow.
a visual. Yeah.
Yeah, it's a very quick visual, right?
Yes.
And you can pretty much see your day,
What's coming.
what's coming, right? The names are there, the procedures are there, and you know how hard or difficult it's going to be.
That's correct.
Right?
Yep.
And we make a story then in our mind, right? Sometimes we even go deeper into the stories, like they're very quick. Like sometimes you would even look at an appointment for one particular patient, and you can pretty much role play that whole appointment of how it's going to go, right? At times we get very adventurous. We even decide the treatment before we actually bring the patient in, of what we are going to do, right? So these are the stories. So the moment somebody new in the industry would have, or a new clinician would have seen that appointment book which said 8-year-old toothache patient, first dental visit, which is their anchor in their story making skills, which means that our textbook actually says that first dental child visit, we do not do anything. We just do a checkup
Bare
today.
minimum as possible.
Bare minimum, because we want to make sure that their dental experience does not get compromised.
That's correct.
For the rest of their life, correct?
Yes.
So my clinician made that story. The story was 8-year-old patient, first dental visit. I'm not going to do anything. I'm going to prescribe. I'm going to do a checkup. I'm going to prescribe the patient antibiotics, and the patient will have to be rescheduled next week for the procedure.
That's correct.
Or
at least somewhere along those lines, that I'm going to do bare minimum and not do any actual clinical procedure because
it's the first dental visit.
That's correct.
Right.
Okay.
And that's the mindset that she walked in the room with. Okay.
Correct.
Now, as she walks in, she sees a very distressed mum sitting on the visitor's chair in the room.
Yep.
And the little girl, 8-year-old girl in the dental chair, she seems very calm, relaxed, and seemed like from a very
She's quite a good young
girl.
patient. Yeah.
Anyway, and then obviously my associate with the story, so she just went on saying that that today we will, she had a look, and then she told exactly what she had thought to the patient. I'm thinking that's what she had thought. Okay, this is my experience telling me how we make the story and how. So she obviously said this to the patient, that I'm going to prescribe you some antibiotics. We can't do anything today, and we will see you in a week's time.
Yeah.
Now, this is when the story shifted. So the mum, she got quite aggressive.
I remember that.
Yeah.
Yes.
And she was using abusive language.
Quite loud.
Quite loud, very unhappy. And that
I think she threatened to do a few things.
she threatened that she's going to go home, and she is going to, if we don't do any procedure today, she is going to go home and remove the tooth herself.
Oh yes, yep.
And then she's going to post photos on the social media
with our business's name.
Name on it. So she was saying all that, and then obviously my young clinician is getting more and more distressed. So I was walking in the corridor, and she came to me, and she's like, Kritika, like, I have a very upset mum in the room. Like, what do you think I should do? She's being very abusive, and my associate is quite upset, visibly upset. So I said, look, I'll come with you, and we will see what we can do. So when I walked into the room, Jimmy, what I see is like a quite upset mum. She's on the phone with her husband, and she's just saying, they are not doing anything. They just want me to go home. They're going to give me antibiotics. I haven't slept all night. I just don't know. I'm going to take the tooth out for her. And my dentist is actually standing in one corner, like really like a timid, afraid dentist standing in the corner. And then my focus went on this girl, 8-year-old girl in the chair, very innocent, completely harmless. She actually looked at me and she said, do you think my mum can actually take the tooth out for me today? And that really hit me. It really got me that my dentist is actually scared or worried about the situation.
Yeah.
The mum is worried or angry that we are not doing the procedure. But that little girl, she's kind of caught in the middle, right?
Yeah, she's caught in crossfire.
Yeah, she is my patient, and she's fine. So
in other words, the dentist, at least in her mind, decided to not see this young girl who is the patient ever again because of mum's behavior.
Yeah, well, that's when she said, that's where when she came to me, she actually said that do we have to see these patients? Like, the mum is being very abusive. Can we just ask them to go? So
to
then
leave,
and we never see them again.
Yes, that's correct.
And I said, and that's when I actually walked in the room.
And you observed the situation. Yeah.
And when you look at the girl, you think, well, we can't do that because she has done nothing, right? And when I'm speaking to the mum, she said to me, because I said to her, look, how about we have a look first? So I had a look in the patient's mouth, and the mum is saying to me that I haven't slept all night because my girl has been in pain, right? I've been diagnosed with a particular form of cancer. I start my therapy on Monday. So clearly there's a lot of stress going on
background story
in mum's life,
to the behavior,
right?
Yeah.
And then she goes on to say that
did she travel
as
well?
Sorry, yes, she did. She traveled 2 hours
to see us.
Yes,
that's correct.
So this is lots going on.
There's lots going
right?
on, yeah.
And so I think this is a nuance that my associate failed to see at the time, or any young clinician would fail to see.
It's a complete picture.
I would have done that. And I think this is where, Jimmy, the dilemma is that we get taught the protocols, that our textbook has a protocol. One protocol is that you don't treat a child when they are coming for a first dental visit, but they are in pain. You do not see an abusive
or aggressive
people. You actually keep your people safe, which is what I wanted to do, and do not let them get distressed, right?
Yep.
And so these protocols are there, but when I draw my attention towards the 8-year-old girl, I feel like she's actually not, she's just a human in the chair who I can treat, and I should treat because she is cooperative. She doesn't even know what was going on in the room. Why was her mum getting upset? And she even thought that her mum was saying that in a very real way, that she will actually take the tooth out, and she was fine with that. And I think that's what's like, it really got to me.
Yeah.
And so I said, so anyway, so yeah, I want to know what's your take on this, on the dilemma.
It's an interesting one because I remember I was there. I didn't see the patient or the mum. I sort of got to know about this sort of afterwards once they were already been dealt with and they left the surgery. And when I got to know that the patient's been rescheduled again to come back, I was very against that because as you said, the protocols, we have a pretty strong protocol around abusive and aggressive behavior
Yeah.
because no one feels safe in executing anything or doing any procedure or their job if the environment in which they are working is sort of threatening, right? So that's when I thought that, okay, no, we don't have to see these people, and I'm sorry to say, but I at that point in time didn't even care about the 8-year-old person because of what I heard mum was doing and saying. But then when I met you, half an hour later, and when you explained it to me, what you observed when you walked into the room, and when you sort of completed the story for me in terms of why mum's behavior was the way it was, who was the real victim in the scenario, which is the young girl who is
Yep.
sitting in the chair, who, as you said, she's just caught in the crossfire between the two sides, which
Yeah.
is, mom has a reason to be very upset, and the clinician has a reason to be very upset. And then
What is the right thing to
what's
do?
the right thing? And this victim is
Yeah.
just someone who is just paying the price. So when the story completed for me, I sort of reluctantly agreed with you that, okay, all right, let's give this scenario one more chance and then see what happens. So the dilemma is real in terms of the very first reaction is that, okay, protocols, they kick in very quickly because you want to protect yourself, protect everybody around you. So the protocols kick in and you want to sort of withdraw yourself out of that situation as quickly as you can. But then at what cost? Right? So that's the first thing we need to understand. And as healthcare provider, we again need to understand and analyze the situation that, okay, who is paying the price here and whose life or health is going or going to get compromised because of our behavior. So it's a hard one. I don't know what the right solution is because there are scenarios where you really have no choice but to withdraw from it, and
Yep.
then you have to walk away
Yep.
without providing the service. But this one was very unique because we are talking about a young girl who has done or said nothing, and if we choose not to treat her, she's the one who is going to pay the price. So
Yeah.
that was a real tricky one, and I guess you can share with our listeners in terms of what happened and how we executed and what we did.
I think like that day it turned out to be very heavy for me. So when you asked me what had
Yeah,
happened,
because I asked you very confronting question
Yeah,
that how
like-
how could you
rebook the patient.
rebook the patient
Yeah.
in a given information? Yes.
Yeah, and I think that really, Jimmy, actually got me because I'm thinking, did I actually make the wrong call today? I have taken the wrong decision
Yeah.
for the whole, on behalf of the whole
Whole
team.
team. Yeah.
And I think, and I had to go for a walk because I could not take away the face. I could not see the face of that 8-year-old.
Oh yeah.
And with the innocent words that she said to me, that she really believed that her mom could take the tooth out. And I think that's what stuck to me because that's what I reminded myself, that my job is to treat this patient. That
Yeah.
is why that is my job. I am a dentist and that is what I'm going to stick to.
Yeah.
And I'm going to physically park my ego on the side, which is what I did. She's not saying anything to me.
Yes.
She is purely distressed. She has traveled 2 hours to see
Yes.
me. She is going through some sort of like health issues, like major health issues.
And sometimes those issues are not that severe, but there are other stresses in people's life which,
Absolutely. And and which I could see that she didn't want to travel that day. She was wanting her husband to come here, but when she was on the phone, she had to be there because he was working. So
yeah,
I think she must have juggled a lot of balls to
to
get
get
there,
there. Yeah,
get there for 2 hours. And I think that is enough for her to be expecting a treatment, but there is no excuse for being abusive or
of course not.
there is
Yeah,
there is no reason for her to do that. And I think I just reminded myself that point that I am going to be empathetic
yeah,
with the patient, and I'm not going to take any of these baits to go back at her.
mm,
And I'm going to establish the boundaries
of course.
with empathy,
Yeah,
which is what I said to her. I said, if you thought that we were not capable, you would not have driven here 2 hours to come for us to see your
of
daughter.
course. Yeah,
So we are the subject matter experts, and she's in pain, and we will treat her. But let's talk about the first visit protocol,
of
right?
course. Yeah,
Which is we want your daughter to see a dentist for the rest of her life in a positive way.
yes,
So in order to do that, we do gather that she is quite cooperative while she's having that communication. She's not anxious sitting in the dental chair. So I said, look, we will try to numb her up with the local anesthetic. But if there was a point where she wasn't getting numb, we will then have to stop the treatment, cease the treatment, and put her on some antibiotics. So which means I was kind of meeting her halfway.
Yeah.
Is that I am going to attempt, because you
So
are here.
yeah, you are basically sort of explaining to the mother that you are on her side, but there are trade-offs in terms of what we can and can't do
Yeah.
for the long-term outcome of her daughter's sort of dental health.
Yeah,
Yeah,
that's
so
right. And I
yeah,
think sometimes I feel like we don't talk enough with the patient. As in, if that was the thinking process, my objections in my brain, if we verbalize that to the patient, that what logic I am actually going through
that's
and
correct.
why I'm saying that, it kind of brings them on the same
Of course.
page.
Do you think that to some degree the anchor did its role, which is
Oh, absolutely.
looking at the book, color, first patient, I mean first appointment, young child.
Straight away.
You already have created this movie in your head that okay,
Yeah.
how next 30 minutes are going to play out.
Yeah.
And and it
Yeah.
happens to all of us.
Yeah.
And when they don't go to plan, you sort of either freeze or you don't know how to deal with that.
Absolutely. And I think these are the things like the biases that we must be aware of, like as you said, like the anchor. Like
Yeah.
it's just there. That bias is your thought process, your judgment, your treatment, your communication with the patient. And you're not even
You run
listening.
with it.
You run with it. And you've
Yeah.
scripted it. And I think that is where the openness needs to be, that which is what I tell myself and my colleagues, that don't walk in. If somebody tells you this patient is going to be difficult in the room, do not walk in with that,
With that
because
mindset. Yeah.
you will never see them easy after that. You'll always see them difficult.
Yes.
And I think that is exactly what had happened. And
Yeah.
we actually done the procedure for that girl that day. And then she has
yeah.
been and seen you again.
For the next one, yes,
Yeah.
that's correct. And I found exactly what you said, because that was the first time I met the family, and everything just went very smoothly in the second appointment. And I guess it's very like 100% correct that okay, those extra piece of information that we get from the appointment book or from the reception staff or from other people, that okay, this patient likes things certain way or
Yeah.
they behave in a certain way, they are there for us to help understand how to modify our approach towards them. But then equally we need to be understanding that these are anchors, that you don't want to hang on to them very tightly, because then you become very rigid in your approach dealing with them, and that can work against you. So
Absolutely.
I suppose it's a balancing act.
I think you can never be prepared enough for these scenarios, right?
No.
You can never be. So it's more like crisis navigation, because you may go in your day just thinking it's going to be a normal day, but then all of a sudden you, like this patient was
I
not
guess we
even,
all were thrown into
yeah,
this thing
we were
very
all,
unprepared.
yeah, she was not even booked with me, but I was just walking down the corridor and I get thrown into this situation.
Yes.
Like when I look back, I know I could have done some things. I could have improved on certain
Yeah.
aspects of that conversation, of that whole communication between me and the mum. What's your take on it, Jimmy? Now that you know the full story,
Yeah.
what do you think we can do better for these crisis communication or discussions when you land into one?
Right. I think the lesson learned for us as a business was, again, as we discussed, that not to get very rigid on our approach.
Mm-hmm.
And it's a perspective thing, in terms of the first clinician walks in with a very clear ideas in her mind that, okay, this is the way it's going to play out. As she enters the room, the reality is slightly different. She, for whatever reason, doesn't know or couldn't respond to it positively in terms of her approach. She wasn't flexible enough, if that's the way to say it.
And she was
And
scared.
she
Or
was scared, and then the aggression just kept escalating.
Yeah.
And then she just didn't know, because of her young sort of clinician life, she didn't know how to respond to some of these things.
Yeah.
And for her, and I would have done the same thing, is that it is very easy to label and see them under the lens of, it is not acceptable and I need to stop here and I'm going to walk away.
Yeah.
Right? So that's the perspective that you get when you find yourself in this situation. But at the same time, when you walked into the room, you looked at it under different lens, and then your perspective was a little bit more that, okay, what's under the surface here? You understood why mom was behaving the way she was. You understood what role was the patient itself was playing, in this case 8-year-old girl. When you entered, you also sort of tried to understand where the young clinician was coming from. So they all were right in their own way.
Yeah.
But then, because your perspective was different or your lens was different, you analyze the situation with a completely different conclusion, compared to the first clinician, right? So it is a crisis management, and there is no sort of one proven way to deal with this.
Yeah.
But there is one thing that I would probably say that what helps me, and I know that we've talked about it quite a lot, that our ability to crisis manage varies quite a lot on what did we do outside of our 8 or 9 hours of clinical life, which is, did you do your coping mechanism? Did you sleep well? Did you eat well? Did you do your exercise or not? Did you spend enough time with people who you love and like to spend time with? Those things really impact our ability to respond to some of these completely unexpected scenarios. Because I certainly know for myself that when I'm not well rested, my ability to have a good communication, to respond to the procedure that didn't go to the plan, or seeing slightly high demanding patient, it all drops. And that's purely because I'm not with my A game, and I'm not there, or my 100% is not there, right? So from that point of view, if the lesson learned for the whole team, or for anyone who is listening to this, being a young clinician, is that the non-clinical hours are equally important, if not more important, than the clinical hours, because that's when you are really sharpening your tools, your head, your mental tools, your physical tools. And then it's the recovery, like for professional athletes.
Of course,
They take their recovery 10 times more seriously than the actual game, because what happens in that recovery time is what's going to dictate what happens in the
On the
actual
day.
on the day of the game.
Yeah.
So from that point of view, I think that is equally important for me.
Absolutely. And I think so, Jimmy, to summarize what you are saying is like if your foundation of how you're yourself, looking after yourself plays a big role. And then the other things of establishing the boundaries, keeping the empathy there, keeping the patient in the
Yeah.
center, all of that adds up on the top. And then that's how you treat the patient. And at the same time, parking your ego on the side, which will come with experience.
That's right.
Um,
There's a lot to it, but
there
yeah,
is
you
lot
have
to
to understand the different aspects and different compartments of the whole thing,
Yeah.
and then you will know how the whole picture sort of gets completed. Yeah,
Big picture, isn't it?
yeah, yes, that's right.
Okay. Thank you, Jimmy. Thank you for joining us at the show today.
Thank you again for having me.
Thank you.
Yeah.
If you have ever faced a scenario like this, where the story in your head clashed with the reality in your room, we would really love to know about this. Thank you for listening. I hope you got something out of it. Don't forget to follow us on Instagram or subscribe on YouTube.